So the burden of SSI in the United States is significant. We spend billions of dollars on SSIs based on some published studies.
Healthcare is at a difficult time right now. Hospitals are packed, and not surprisingly, patients that have wound infections or really any sort of infections have a higher cost of care.
Burden has a personal impact, it has a societal impact, it has a facility impact. There's going to be profound impact financially, emotionally, the ability to make a living.
Most of the times when patients come in to see you, if they have a wound problem, that's something that they review you on. The ability to be able to avoid those infections altogether is huge.
So if there's something that we could implement that could reduce infections, there's tremendous downstream opportunities for healthcare systems and hospitals to improve efficiency, throughput, and cost.
So there's some things that we'll do that will alleviate some of the surgical site infection risk. As we do the surgery, we'll actually use plus sutures. So that if there is a risk of an ascending infection, we feel that the plus sutures will alleviate some of those problems.
If we're using things like Ethicon's antimicrobial suture, we can reduce some of that risk and reduce that impact on other things and save money and have a better outcome for our patients. So we can drive those infections down from where they are today.
I think the biggest value is the antibacterial properties of the suture. You don't notice any difference from non-plus suture. They feel exactly the same, but you have this added value of less wound infections. We want to have better outcomes that drives quality and also patient satisfaction. So I think it's sort of a no-brainer to use this technology.
When I was a corporate director in a hospital system, we actually implemented the use across the board, and we had close to a 38% reduction in our infections with using them. The data's there. That's all I needed to have in order to convert not only a hospital, but a hospital system to the plus technology, because there was the evidence.
So plus sutures, more than just about anything that I use in my practice, has the best evidence behind it. The amount of data that's available internationally in the US, looking at meta-analyses and randomized control trials, it's pretty convincing evidence.
So the Centers for Disease Control recommends the plus technology. We also have the World Health Organization. We have the American College of Surgeons. We have the Society of Hospital Epidemiologists of America. But when you've got that much evidence and these guidelines saying to use them, it should be part of the bundle, period. I always think of what's at the end of it is a patient.
If you're worried about investment in inventory on the shelf, then don't carry both. Standardize to what is recommended in the guidelines.
I myself didn't recognize the benefits of plus sutures until someone actually came to me and said, hey, have you seen this product? And really, when you look at risk-benefit ratio, which is something we all look at as physicians, the risk-benefit ratio far, far favors the use of a plus suture regarding, surgical site infections and patient outcomes.
We have to do better. We can do better. And it's imperative that all of us follow these guidelines to be able to drive these numbers down.